We're going to get started with this afternoon's speakers. So in this room, we have Miss Tabatha Doyle. And Tabatha Elrod Doyle graduated from the Baptist School of Nursing in 1996 with her RN degree. And since 2007, she has worked in her current role as a coordinator in the brain tumor program at St. Jude's Children's Research Hospital in Memphis. And she works tirelessly in assisting families in advocating for their children and the care that they receive. And we're really excited to have her here with us today.
Good afternoon, everyone. First of all, thank you for letting me be here, because this is my passion. This is what I do every day, and this is what is the most important to me. You can't have clinical trials and treat brain tumors without taking care of the patients. This is the biggest part of what we do, and it's always been a huge thing to me just to know that you're not just treating a brain tumor, you're taking care of the whole family. So that's kind of what I wanted to focus on today is family-centered care and encouraging families to be an active member of the healthcare team. Family-centered care kind of emphasizes mutually beneficial partnerships among patients, families, and healthcare providers. So essentially, to me, this means that the family is the center of everything we do. They are the ones that lead us to make decisions on what we need to do to take care of their children, because as parents, we have to advocate on what we need our children to do. And that's really a huge thing, especially at St. Jude. Patient and family-centered care started many years ago, and it was actually part of former Surgeon General Coop's initiative for care of children and their families. The focus was to be family-centered, community-based, coordinated care. And this was something that has really evolved over the years, and most pediatric hospitals, this is their primary focus. And most of the children's hospitals, even, I know Sick Kids even here is one of the hospitals that they focus on this primarily. It's an approach to healthcare that focuses on the family as the child's primary source of strength, support, and well-being. Without the family, the children would not be able to make it through what they make it through each day. I've seen many patients at St. Jude, and we brought in patients from, close to Memphis, all around the world, and my primary focus on the front end is always to take care of the family. I'm the first point of contact when they call St. Jude. I'm the person that walks them through every step. So I become their friend. I find out what they need, what is their primary goals for St. Jude. One of the things that I've learned through the years is that every family is different. Every family has different needs. Every family has things that is more important to them than other things. And you've got to learn to focus on what's important for each family. At the heart of patient family-centered care is the belief that healthcare staff and family are partners, working together to best meet the needs of the child. I saw a quote the other day from the 1960s that said, follow your doctor's advice, do what the doctor says, which is interesting because, that's the way medicine used to be. You did what the doctor said, you followed orders, you didn't ask questions. So these days, as families, we need to be partners with healthcare. We need to know that the most important thing is that we have a say in what happens to our child. We need to know that we're not being told what to do and saying, yes, doctor, whatever you say is best. You have to be able to be involved. That's really a very important thing, especially as a parent. Excellence in healthcare happens when we work together and honor the expertise each of us brings to every health encounter. Patient family-centered care is a continual effort to be responsive to the needs and choices of each family. It's one thing for a family to tell a healthcare provider what they need. It's another thing for the healthcare provider to actually listen and do things that make things better for them. Core concepts of patient family-centered care: dignity and respect, information sharing, involvement, and collaboration. Ingredients for success to make all of this work: families are encouraged to partner with their healthcare providers in decision-making, patient care, information sharing, and families are given a safe environment to voice their concerns regarding care planning and delivery. One of the most frustrating things I can hear from a family is for them to call and say, I was never told that I could get a second opinion. I was never told that I have other options. I think it's important for families to know on the front end that this is what your child has. These are the options. You need to teach them. You need to give them options. You need to let them know. Give them the opportunity to ask questions. If families don't know there are other options out there and they don't know that they have rights, then they're not going to ask questions. So this was really something that said a lot to me because, that's one of the first things I tell families when they call us, is the first thing you need to do is know that you can get a second opinion. Practical application for brain tumor families. When approaching families of children with recently diagnosed brain tumor, it's really hard because this is such a unique group of patients and families. I cannot imagine being told that my child has a brain tumor. That's very hard. And a lot of families are in shock and they feel real helpless. And, for the first 2 weeks, it's very overwhelming. And so they don't realize that they can ask questions. They don't realize they should be doing something different. This is when it's really important for healthcare staff to step up and say, what can I do to help you through this process? What kind of support do you need? Here's resources. Let's take it day by day. It's not something that's necessarily going to get better in one day, but if you walk through the journey together, it makes a huge difference. Brain tumors in children. This is all something I'm sure all of you know very well because all of you have been through so much. Brain tumors are the most common form of solid tumors in children under the age of 15. They're the second leading cause of cancer-related death in children under the age of 20. The biggest thing for us, and this is one of the things that we focus on so much, is that children aren't small adults. You can't treat a child like you do an adult. They have very special needs. Brain tumors are treated differently than brain tumors in adults for a reason. The cure rate for most brain tumors is significantly lower than other types of cancer. Because brain tumors are often located in the control center, there's so many different things that can happen to patients with brain tumor surgery, with radiation therapy, that can really cause late and long-lasting effects that can be very devastating to children. While many children will survive their brain tumors, they're often left with long-term side effects. For these reasons, many others, families of a child newly diagnosed with a brain tumor, find themselves thrust into a crisis. And it's really hard for families to know how to navigate without help. The long-term side effects is another thing that we get a lot of calls on. I'll have families call me and they've survived their brain tumor and their child is 10, 15 years out and they're out of resources. And they have needs that they don't know how to meet. And they need help with them. And they need to know how to navigate the system, who to talk to, what resources are available to help them. And even if we can't help them at St. Jude, I can provide them with resources that can get them to someone that can. Because, these side effects don't go away. And there's something that these patients need help with. This is the other thing that's really huge is parent empowerment and patient advocacy. Your child's just been diagnosed with a malignant brain tumor. What now? This is one of those questions that I always get asked. This is probably the hardest news that anyone's ever heard is my child has a brain tumor. Knowing what to do and where to turn for answers is one concern. For the parents of children who are battling this, so much feels like it's out of control, but it's really not. My goal would be in the next 10 years to have services in every children's hospital that is there from the front line to say, I'm here to help. This is what I do. I'm your person that you come to walk you through each and every step. I think that would really make a difference in how patients cope and how parents are making it through the first 2-4 weeks of their diagnosis. Tell your story. This is probably the best advice I give daily to families is, tell your story. Tell me what happened. Tell me what's going on, and let's go from there. For me, it's very important to hear the perspective. It helps me process what they need, where they're struggling. I get many calls a day, and we can't always help everybody. But sometimes just being the person on the phone that takes the phone call is more of a help than anything. I had a mother that sends me a Christmas card every year that I've never met. And she called me when her child had a progressive brainstem glioma. And her child was on hospice and was very near dying. And she just needed to know that there was no other options. So she called, and I said, tell me your story. What's going on? What do you need? And she goes through, my daughter was diagnosed a year ago. She's progressive. I don't know what to do. Can you cure my daughter? And I said, you know what? I can't cure your daughter. But I want you to know that if you want us to review your daughter's case, and you want us to look at imaging, and you want us to review everything and just make sure everything's been done that you can do as a parent, we'll do that. And so we did. She sent all of her information. We took a little bit of time. We reviewed everything, and I called her back and I said, everything that can be done has been done. And she said, that's all I needed to know. So, for me, that's rewarding. And now I'm going to get emotional. So you can tell how important this is to me. I apologize. For her, that was closure. And for me, it was closure. And each year she sends me a very nice card and says, thank you. Thank you for taking 10 minutes to speak to me, and you don't even know me. That's important. I also get a lot of calls from families who are frustrated. They feel like they can't ask questions, they're not involved. What do I do? One thing I've realized is that most of the time it's just about communication. The physician doesn't realize that the family's upset. The family's so upset they can't talk to the physician when he's around, and everybody's just doing their own thing. So usually what I'll tell families is, you know what, sit down, ask for a team meeting. Whoever you need there, have your neurosurgeon, have your radiation oncologist, have your oncologist, have your social worker, have support with you. Sit down with the team and say, this is what's frustrating me, this is what I need you to do to help me out through this. And I think a lot of times, if it's put on the table and you tell them what's wrong, tell them your concerns, then they'll listen. When the doctor's coming in and out of the clinic room and you've got 5 minutes to be seen and he's in a hurry, it doesn't always happen. But a lot of times if you stop them, set them down and say, you know what, this is what I need you to do to make this work for me. This is the support I need. These are my needs. This is what I need for my daughter. Then it really helps. And I've had many families call back and say, you know what, it worked. Now they're, interacting with me. Now we're asking questions. Now I feel more like part of the team. A lot of times it's just because our doctors get very busy, and, it's an excuse, I'll be honest, but they get busy and they just don't realize it. Don't be afraid to verbalize your needs. That's very important. Be informed. If the doctor's talking about something you don't know, ask questions. I always tell my families, have a notebook and pencil with you everywhere you go. Get copies of all your records. Have copies of your scans. Have copies of your pathology reports. Make a notebook. These are things that are just going to help you through the process. These are things that are going to empower you to advocate for your child. If you have all of this and you have your questions written down and you are ready, things will be so much easier and flow so much better. And, find out resources. We have the American Brain Tumor Association in the USA that is an amazing resource. There's so much information on their website. They have so much stuff. And I use that for all of my families. I'm like, here's a resource, here's the website. They have so much available that you would never know was there. So that's a resource I use a lot. We have a wonderful website at St. Jude. I know that you have lots of groups here in Canada as well that have great websites, because I've been out looking with lots of resources. So there's definitely information out there. It's just knowing how to find it. And it's okay to ask, The other thing to know is know your rights. Legally, your child cannot be treated without permission. You don't have to sign protocol if you're not ready. You don't have to be pushed into treatment. You always have the right to ask questions. You always have the right to get all the information you need to be informed. I get a lot of calls from families that are 2 weeks into treatment, and they say, I was never told there's other options. I was told we had to start treatment today because my child was going to die from a brain tumor, and so I signed the line and we started treatment. And there are cases where patients do need to start treatment urgently, but there are a large number of patients that have time, but they feel pressured into signing consents and starting treatment, so they do it. Because as a parent, what you don't want to do is not start treatment and feel like it's your fault if something happens. Just know that you have options, and you can. You can say, you know what, I just need a second opinion, or I just want to talk to other groups. I just need to know that what I'm doing is the right thing. If you have conflict with your group, be specific and non-confrontational when you're describing the problem. You can do the case conference we were talking about earlier just to work through issues. There's always going to be conflict. You're going to have days where you're tired and your child is tired and the medicine room is backed up for 6 hours and you want to get out of here because you have somewhere to go and a nurse is going to make you mad or someone else is going to make you mad. It happens. But the best thing to do is when it does happen, just to say, this is what I'm frustrated about. This is what I need you to do to help me. A lot of times if you present it that way, things go much smoother. Communicate. Clear and frequent communication is the lifeblood of successful relationship. I can't tell you how much we focus on that at St. Jude. It's all about communication and group communication. And, we do a lot of multidisciplinary meetings. That's a huge thing at a lot of these groups because we collaborate with a lot of these hospitals is, one doctor can't treat a patient by themselves. There's so many people involved, and all of those people are there to make sure that we take care of everything. So communication. If there's things that you feel like are not happening, communicate and tell someone. Effective communication, same thing we said. Explain to the staff what you like to know. Inform caretakers of your child's likes and dislikes to facilitate working relationships. So this is where child life comes in really helpful at our institution. Child life has been a really wonderful thing to have because they actually work with the kids to focus on what makes them feel better about procedures, what they want to know. It's very frustrating when a patient comes in, and it depends on the age. There's some families that come in and the child is 3. How do you tell a 3-year-old they have a brain tumor? And then there's 15-year-old children that come in that, parents will say, I only want them to know part of it, or I only want them to know this. So it's working together. You've got to know what is appropriate for the child to know and how to talk to them about it and how to help them cope with everything going on. And Child Life has really been phenomenal in helping families and children work through all of this. Discourage anyone from speaking in front of your child that, like he or she's not present. I think the key with, especially the older children, is when the physician actually involves them in the conversations. You can't talk around them to mom and dad. You've got to make sure that they know they're there and they're aware. I remember a patient of mine that was absolutely very so close to me and one of my favorite teenage patients that I've ever had. And he had been going through treatment for many, many years, and he was tired. And, we always include him in conversations, but he was very tired of being treated, and Mom was not. So we got to a point where he said, I'm really getting tired, but Mom didn't want to hear it. So he said, well, I just need 5 minutes with Miss Tabatha. So Mom's like, okay, great, we'll leave you alone. And she left the room, and he said, I am tired. I've been through a lot. I need my mom to know that I'm tired. And I said, this is a very hard place to be because you're 15 years old, you're tired, he had had like 4 or 5 relapses by then. I said, we need to sit down and talk to Mom as a team. And we need to work through what she needs to be at this point and where you're at, and to get everybody on the same page. So we did. We sat down as a team. It was myself and his physician and our nurse practitioner and Mom and Dad and social work. And he just said, this is where I'm at. This is what we need to work through. And this is, I'm tired. I just really want to stop. And it was about a 2-week process. We saw them daily for about 2 weeks. And him and I had conversations daily. And Mom would have conversations with the physician while him and I would speak. And finally, Mom was there. She was like, okay, I'm good. I'm good with this. Let's do hospice. And I would call him daily, and we would speak on the phone. So Mom calls me one day, and she says, Tabatha, he hasn't spoken in a day, and I'm really concerned. And I said, okay. She said, he's awake. I think he's just angry with me. And so she took the phone and she put it on speakerphone, and she took it into his room, and she said, I have Tabatha on the phone. And all of a sudden he goes, hi. And I mean, you could just hear Mom crying in the background. And I said, what's going on? And he says, well, I'm very angry. And I said, okay, it's okay to be angry. And he said, and I'm very scared for my mom because she's not going to be okay without me, she told me. And I'm in pain, and I don't know what to do. And it was very overwhelming. And, Mom says, of course, then she figures out why he's so angry and why he hasn't spoken to her. And she's just speechless. And I said, you know what? I said, it's okay. Put Mom back on the phone. I said, I am here for you. I'm going to come out and visit you. Put Mom back on the phone. So Mom got on the phone, and she said, I haven't been able to tell him it's okay. And I said, I think it's time. She said, I knew that this is what he needed. I knew he needed to talk to you. And I said, it's fine, I'm coming out there. You talk to him. And so she did. She talked to him that night. I went the next day, and he was resting very, very peacefully. And within 2 days, he finally let go. So, it's amazing. Sometimes it takes a lot of work, and sometimes you put a lot of effort into it, but it's all worth it. I cannot imagine not being part of that. And, I'll remember that forever. Essentially, this is one of my huge things that I love this quote. Creating a relationship that supports, enhances other people is perhaps the most single critical strength you can ever develop in your life. It often defines the legacy you leave when your life is over. For me, I love being at St. Jude. I love being part of the trials, but for me, it's all about the relationship with my families. That's what I do it for. And even if I never do anything great in life, this is enough. This is St. Jude. Our new motto is working together to give your child the best care. It's a continuing process. Yeah, so I think it's something really important. And sick kids, we've worked with them for many years on a number of our studies, so I was pretty sure they were also involved in that. I think it makes a huge difference. I think the family should be the center of everything we do. I mean, that's who it's about. It shouldn't be focused on what our needs. It should be focused on theirs. And then this is my family. Questions, please. Thank you.